The figures look promising. At the end of January, there were 50 patients in the 8 centres MSF runs in Liberia, Guinea and Sierra Leone. But complacency would be disastrous. The drop in the number of cases is the opportunity for the teams to focus on breaking the chain of Ebola transmission and to provide their patients with the best possible care. MSF has decided to open a maternity unit in its Ebola treatment centre in the Freetown suburb, Kisii, to deliver specialist care to pregnant women infected with the virus.
When a pregnant woman contracts Ebola, she has many more chances than other pregnant women to miscarriage or to have a complication associated to her delivery. So they require specialized care as any other pregnant woman, and they require this to be done in a setting that ensure infection control measures that will avoid transmission to the staff.
One such patient is Adama, admitted to the centre in Kisii. She lost the baby she was carrying, but she did survive Ebola.
She's going to be discharged today. She's cured. So we're going in to do her discharge shower so that even though she's not infectious, maybe some of the items that have been in the confirmed tent are. So we're going to do a shower to disinfect everything, give her new clothes, and then she'll be able to walk out as a cured patient.
After spending several weeks at the centre, it's now time for Adama to leave. Before taking her back to her family, the MSF team offers her psychological support. Until now, not much was known about the disease, and even less when it's contracted during pregnancy. Doctors have treated a large number of cases during the epidemic, and they've seen that while the chances of a fetus surviving are virtually non-existent, they can help mothers. The water is beginning to recede, but the South Malawi plains are still waterlogged. Some very low-lying areas look more like islands and can only be reached by helicopter. Burita was 8 months pregnant when water started rising up around the village of Makanga. She gave birth just a few days later.
We went
to Makanga Clinic, but it was closed. There was no one there to help. I was told to wait. I was told that a helicopter was coming, that it could take me to another clinic. Fortunately, when the helicopter arrived, it brought with it someone from MSF to help us.
Flooding such as this can trigger epidemics, especially malaria. 20,000 people remained cut off from the rest of the country, so MSF is scouring the region by helicopter to provide them with medical care and distribute medical supplies. These MSF workers are preparing to distribute medical supplies to hospitals in East Ukraine. Constantly changing destination and working on both sides of the front line, they provide assistance to health facilities frequently lacking even the most basic supplies.
So far we have provided this kind of kits in 70 hospitals in both sides of the conflict. We have treated, this material is enough to treat around 15,000 people.
This support enables hospitals to continue to deliver treatment to people wounded in the conflict, as well as to the chronically sick and expectant mothers. But the bombing is hampering their work and denying thousands of people access to medical care. In just 2 weeks, 5 facilities supported by MSF have been damaged or totally destroyed by rockets or mortar shells. At the end of 2014, MSF launched the first clinical trials for Ebola treatments in 3 of its centres. So let's find out what's been happening. First of all, how is a new drug developed? The process starts with preclinical trials to evaluate, select, and transform the most promising molecule. Then it's on to the clinical trials. During phase 1, the drug is administered to healthy volunteers to gauge possible side effects. During phase 2, it's administered to patients to assess efficacy and determine the appropriate dose. The third phase compares the tested drug with an existing treatment or placebo. And once all these trials are successfully completed, the drug is ready to market. Under normal circumstances, the process takes up to 10 years. Due to the scale of the Ebola epidemic in West Africa, the World Health Organization agreed in August to fast-track clinical research. This meant that clinical trials would be launched on 8 drugs viewed as particularly promising. What are the guiding principles? Streamlining and adapting research protocols to the setting, producing drugs swiftly and making them available in sufficient quantities at an affordable cost, informing and working closely with the authorities and local communities to ensure their commitment, and sharing results as they become available. In November, MSF announced that 3 clinical trials would be conducted in its treatment centres in West Africa. Tests began in Guinea and Liberia on favipiravir and brincidofovir, 2 orally administered drugs. The brincidofovir trial had to be cancelled almost as soon as it began due to a lack of patients. The third trial, also in Guinea, is assessing the efficacy of transfusing blood products from Ebola survivors to infected patients. Initial results should be available in February.
My strongest impression is that it's still a massive crisis going on there. Having been there before and then going again to work on Syria, I've started to understand that everything's getting worse and worse, nothing's improving. So it's quite a depressing situation to work on. It's particularly frustrating, I think, for us now because we no longer have international staff inside Syria. So it's the impression that I get is all second-hand information from our national staff working inside. And what they're telling me and what they told me during the last few months was that it's a real disaster inside. They're living inside Syria, so as well as their job, they have, the usual stresses of living inside Syria. They're worried about being under attack. They're worried about their families. They're worried about the patients. They're worried about what could happen next, with the concern that maybe, one day MSF might leave because we've pulled out international staff. So they need reassurance that we're there to stay. We're there to try and carry on working.